Hi everyone, I'm here with Sarah Christie today, who's come to join my class and talk about Project Last Mile. So far we've been meeting with social entrepreneurs that have started new ventures, whether nonprofit or for-profit. And now we're moving on to talk about innovation in public health across institutions, right? To reach the Sustainable Development Goals, we're not each going to start a new venture. And so Project Last Mile really speaks to that. So tell us a little bit about what it is and who are the players.
Sure. Thanks so much. So in 2010, Project Last Mile began as a proof of concept, and it really stemmed from a very simple question, which is, if you can find a Coca-Cola basically anywhere in Africa, why can't you find life-saving medicines and vaccines? And a simple question drove a call to action, which was really to approach the Coca-Cola system with how they could assist to develop supply chain logistics, strengthen healthcare systems, and also generate demand for health services. So the question was really posed by Bill and Melinda Gates Foundation, and then the Global Fund and USAID supported this mission to explore whether a private-public sector partnership could be leveraged to strengthen the public health systems. And Project Last Mile works directly with ministries of health to align the projects with what the greatest needs are in terms of supply chain and logistics. So that is really the germinating seed of Project Last Mile and how it became a partnership with the Coca-Cola Company and its foundation.
So it's several ministries of health in Sub-Saharan Africa in partnership with the Bill and Melinda Gates Foundation and Coca-Cola.
Yes, and supported by Global Fund and USAID.
And the Global Fund and USAID. So it's 5 institutions in each country working to strengthen the supply chain so that you can have access to medical needs, goods and services the same way you'd have access to Coca-Cola at the little mom and pop shop in every village.
Exactly. It's leveraging that local route to market expertise that has given Coke basically unparalleled reach across the continent, and applying some of those lessons learned and some of those route optimization and supply chain tools with the public health ministries.
And so I'm sure that a lot of building this idea and implementing it is similar to how a social entrepreneur would come up with a new idea and build a new venture. And yet, because you're working across several organizations, it must be much more complicated. I wonder if you could tell me what are some of the challenges that you've observed in getting all these complex organizations to work together, and a little bit about your theory of change, because there must be very good reasons why ministries of health don't operate like a global corporation in terms of efficiency.
Sure. Well, I think I should start with basically the Project Last Mile partnership began in 2010 with 2 proofs of concept partnerships in Tanzania and in Ghana. Very different work streams. One was straight supply chain, and the second was around cold chain maintenance and demand creation for vaccine viability and availability in Ghana. So really, I think one of the challenges, or one of the head-on approaches we take, is an engage and align phase. And that is where we do bring all the stakeholders together from the inception to actually conceptualize the project. Where does the Coke system expertise meet the demand of the public health sector? So really, that piece of work is something that usually is not fundable. So I feel like that is a really nice way we can really hone in on exchanging knowledge, sharing expertise where it benefits the country the most. And in our model, it's not, it's working directly with the ministry. So we are not bringing it to scale through other means beyond the capacity of the ministry. And I feel like that is one way we empower or strengthen the current capacity. Obviously, there are huge resource constraints with public health sectors. They won't have the bandwidth to do the changes that make Coca-Cola a multinational profit-making industry, but they definitely have strong infrastructure in terms of strong infrastructure is the wrong word. They have a governance capacity to administer change. A lot of times for example, they could be getting their medications from different donors, different funding streams. That could complicate logistics. They have limited access to tools and data that can make the public health system more efficient. They are also dealing with elements of nature, poor roads, rainy seasons, things that influence the public health sector tremendously, particularly in the hard-to-reach areas. And those are areas that, can be afflicted by lack of supply chain, gaps.
A couple of things you just said now made me realize what an important role funders play in these types of partnerships and in public health in general, in a low resource context. So international aid has influenced the way that public health is implemented in, let's say, Tanzania, which I know is one of the pilot countries,
Yes.
and has influenced the way the Ministry of Health delivers aid and has been part of the supply chain for drugs. At the same time, you mentioned that funding for these partnerships and these innovations is difficult because probably it's hard to say, like, this is how many people will reach, this is how many drugs will deliver, etc.
Exactly.
And I know that in general, systems entrepreneurs and innovators are always talking about how do you get funding and support for innovations that go beyond number of people served, right?
Yes.
We're not McDonald's, I keep saying. And so can you speak a little bit about that? Because one of the Sustainable Development Goals is building global partnerships, and global partnerships are required to reach all of the Sustainable Development Goals. So how can funders, both private sector and foundations and international multilateral agencies, get beyond those basic metrics? Or, well, A, do we need to get beyond those basic metrics of people served? And B, if yes, how?
That's a great question. I feel I was remiss to introduce our role in the partnership. I'm the program manager for the Yale Global Health Leadership Initiative, and we are charged with the monitoring and evaluation framework for all the different projects that are funded and supported by the Project Last Mile Partnership. And it's exactly right that we really struggle because the strength of the partnership and those key performance indicators really become developed probably after the project is ending or sort of midstream. And so what we really do is employ a mixed methods design or a process evaluation to really see how the partnership has evolved. Is it going to make the impact and have the staying power that we hope it will? So how we do that is we do track basically inputs, which are the in-kind investments from the Coke system, as well as the financial investment across the donor partners. Then we also track outputs, the achievement of deliverables. How can we achieve what we plan to achieve to scale? Then we look at outcomes, which are sort of those intermediate steps where we hope to see impact or the potential for impact. And then if we are there long enough in country, we would track impact. But I think it is not a traditional scope of metrics that we would like to apply to this partnership. But I do think there is a rigorous measure, and we are objective evaluators, even though we are funded by the partnership. We really do try to assess from multiple stakeholders using qualitative interviewing what the perceptions of the partnership have been, strengths and challenges, lessons learned. That helps us to understand any attribution of Project Last Mile to some of the country's scope, but it also helps us to sort of do real-time corrective course and provide that feedback to partners on the ground.
So it's really innovation across the innovation spectrum,
Yes.
where when we talk about building new ventures, we talk about coming up with the idea, implementing it, evaluating it. And when you're doing that in the context of a partnership, you have to add a whole other layer of innovation about
evaluating the
how
process.
to ideate and
Yes.
how to innovate and how to evaluate.
That's right.
So thanks so much, Sarah, for joining us today. Sarah and I and other researchers will be publishing a paper soon, hopefully, about evaluating the relationship in the partnerships and building trust. So stay tuned for that. Thanks, Sarah.
Thank you.